the dance sensations that are sweet with a nation at the hop. You can't swing it, you can move it, you can really stop and move it at the hop. Where the jockey is the smooth and the music is the boots at the hop. All the cats and the chicks come to get their kicks at the hop. Let's go to 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 the hop.
Why do birds sing so gay? Love is the way to rain today. Why do they fall in love? Why does the rain fall from above? Why do fools fall in love? Why do they fall in love? Love is a losing game. Love can be a shame. I know I'm a fool, you see. So that wouldn't be. Tell me why. Tell me why. Why do birds sing so gay? And lovers are way to break the day. Why do they fall in love? Why does the rain fall from above? Why do fools fall in love? Why do they fall in love? Why does my heart skip a crazy beat? For I know it will be easy. Tell me why. Tell me why. Why do fools fall in love? Mama said there'll be days like this, there'll be days like this. Mama said there'll be days like this, there'll be days like this. My mama said, I went walking the other day, everything was going fine. I met a little boy named Billy Joe, and then almost lost my mind. Mama said there'll be days like this, there'll be days like this. My mama said, there'll be days like this, there'll be days like this. My mama said, my eyes were wide open, but all that I can see is chapel bells of old. Every kind of letter, but I don't have to call. Mama said there'll be days like this, there'll be days like this. My mama said, there'll be days like this, there'll be days like this. My mama said, someone will look at me like I'm looking
145 over 92.
180 over 111.
182 over 100. And I had a heart attack and a cardiac arrest, and then a stroke.
This is what high blood pressure looks like. You might not feel its symptoms, but the results from a heart attack or stroke are far from invisible or silent.
My memory is shot.
When I woke up, I couldn't speak.
I can't button up a shirt. I can't run.
I've had to learn to swallow again.
That's the only moments that I have. And I'm 33, so I never see this coming.
If I would have followed a treatment plan, I would not be in this situation.
Had I done this, had I done that.
Hell, I messed up.
Get back on your plan, or talk with your doctor to create an exercise, diet, and medication plan that works for you. Go to loweryourhbp.org.
Head to toe, everything's changed. Head to toe.
Good morning and welcome. I am Erin Wilder, Executive Director of the American Heart Association in the Coastal Bend. We are absolutely thrilled you are able to join us for the first in a series of community conversations brought to you at no cost by Life is Wise sponsor, Christi Hospital, and community conversation sponsors, the Port of Corpus Christi and Corpus Christi Medical Center. We're going to start with an internal PSA. For the best experience today, you'll want to be participating through Chrome. And we know that everyone has different demands on their current internet, especially if you are working from home. So if your internet buffers at any time, try reloading and refreshing. Also, we have several panelists joining us and many logged in for viewing. We have muted everyone's lines and only the panelists are visible. Yes, this is interactive, as there will be time for questions. When that time comes, please use the chat box below for any questions or comments you may have. Today's event is intended to do what the American Heart Association does best, and that is educate and activate at the local level. So thank you for joining our conversation about high blood pressure. While we only have less than an hour together, we have an incredible program planned for you, moderated by Dr. Nellie Garcia-Blow. Dr. Garcia-Blow has been a tremendous force with the AHA as chair of the Hypertensive Collaborative. Dr. Garcia-Blow works with a committee of passionate champions within the community who strive to educate and fight high blood pressure every single day. As a geriatrician with Christi Hospital, she works closely with many other physicians around the Coastal Bend to improve the quality of life of all people within the Coastal Bend. We are excited to bring to you all this opportunity, virtual, live, and interactive. Thank you again for joining us. And without further ado, let's get this show on the road.
Thank you, Erin. Good morning, everyone. Yes, we are thrilled to have the opportunity to talk, educate, and answer questions live and due to social distancing restrictions virtually with a wonderful panel of physicians and healthcare experts. Hypertension or high blood pressure is a key predictor for heart attacks, strokes, and other heart-related life-threatening events. At least 48% of all adults in the United States have some form of cardiovascular disease. Let's listen to that again, 48%. Much of the prevalence is driven by an increase in the number of people classified as having high blood pressure. Unfortunately, Americans are unaware of their issue. Hypertension is often referred to as the silent killer because most of the time there are no obvious signs or symptoms. However, it can be managed with proper care and control. I am proud to introduce you to a panel of friendly faces joining us today from around the Coastal Bend. Good morning, panelists. As I say your name, if you could please introduce yourself and tell us a little bit about your specialty. And I always love to hear your why. Why is heart disease and stroke and the American Heart Association so special to you? Dr. Alma McDaniel, family medicine.
Good morning. I hope you guys can hear me okay.
Yes.
So I'm Dr. Alma McDaniel. I'm a practicing family medicine physician, and also I'm Associate Program Director at the Christus Health on Texas A&M Family Medicine Residency Program here in Corpus Christi. I truly love geriatric medicine and education. And so why is hypertension and heart disease and all of those things important to me is because like I said, I love education, and teaching medical students and resident physicians about something that affects so many people in the world and in our community is something that's near and dear to my heart.
Thank you, Dr. McDaniel. Dr. Crystal Cuevas, cardiology.
Hi, my name is Crystal Cuevas. I'm actually born and raised here in Corpus Christi, so I am very honored to be able to come back and give back to the community and teach about cardiovascular disease. And I am an interventional cardiologist here in town, and really cardiovascular disease just is such a huge impact for society. Unfortunately, we have so much more education that we need to provide to the community. So I really thrive and enjoy teaching and providing this education to the community and to other patients. My family was significantly impacted by cardiovascular disease, and so I like having the opportunity to help families through those times and provide information and education. So hopefully that we can increase awareness and treat these conditions better in the future.
Thank you, Dr. Cuevas. Belinda Flores with South Texas AHEC.
Hi, my name is Belinda Flores. I go by Belle, and I'm with South Coastal AHEC, part of the South Texas AHEC at the University of Texas Health Science Center in San Antonio. The why is because I am from here. This is my familia, right? Everyone around me and stuff. And so my why is making sure that we level the playing field for everyone to get the care they need, to get the education they need, and to be proactive with their health. We have to do what we can to stay healthy, even if it's little bits at a time. So my why is I want everybody to live the best life they can.
Thank you, Belle. We appreciate it. Christina Perry, nurse practitioner with Corpus Christi Medical Center.
Hello, everyone. My name is Perry. I'm the cardiology coordinator here at Corpus Christi Medical Center. Like Dr. Cuevas, I was born and raised in Corpus, have lived here my whole life. And it's been a privilege to work with cardiology in one way or the other my entire nursing career. Way too many years to talk about. But my why came from my family as well. I lost my father to a heart attack when he was very young. And then I subsequently lost my mother to a stroke. So heart disease has hit my family very hard. And I know that my family is not the only one. So educating the public and doing what I can on the backside to help our patients, keeping families together. That's my why.
Thank you, Christina. We appreciate you being here. What a wonderful panel. We also have Dr. Emron, who's a pediatric surgeon, and we understand all of our clinicians and healthcare providers have a very busy practice. He got caught up in the operating room. We expect him to join us, but we appreciate everyone taking this time out to be able to educate our community and give everyone what we always say, right, a chance to be able to live a healthier, happier life. So what an honor to be with all of you. Thank you very much. This hour is really shaping up. As we begin our conversation, we will discuss various aspects of high blood pressure, including the risk factors we should be aware of, complications that can come because of long-term hypertension, and some of the ways that we can control our own high blood pressure. We will also look at pediatric obesity, how early intervention and programs like the American Heart Association Kids Heart Challenge make a real impact in connecting with our youth right where they are. First, I would like to begin by addressing what the American Heart Association is doing to respond to high blood pressure, both nationally and locally.
About 1 in 2 Americans is living with high blood pressure. That is 100 million Americans, but that number is really enormous and kind of hard to quantify. So for me, that means my husband and my mom and many other members of my family. But what's even more concerning than that 100 million is that just under half of those people have uncontrolled high blood pressure. And that means we have a lot of ticking time bombs walking around, tens of millions of them that are so close to that heart attack and stroke, and those are the lives we need to save. There is good news. High blood pressure can be controlled, and those lives can be saved. Our science volunteers often tell me that high blood pressure is the most easily modifiable risk factor. We've really attacked blood pressure kind of from the top down and the bottom up. We started with Target BP. That is our initiative in the clinical space, where we are going into large healthcare systems, small community clinics, rural communities, and we're taking our guidelines and distilling them to simple, easy checklists and algorithms. We're helping providers do what they are meant to do, following our guidelines in a simple and easy way, and ensuring that every patient that walks through the door gets the very best treatment plan. We crossed over 150 million total patients are covered by our Target BP initiative, and we're already seeing control rates soar from that 50-ish% where we started to 70% and greater. The second strategy that really complements Target BP and that clinical system is check, change, control. So we are making sure that patient gets the right treatment plan when they're with their provider, but when they leave the walls of that clinic, they have a program that's meant to support them so they can follow that treatment plan. They can practice things like self-monitoring of blood pressure. They can learn better eating habits, learn new cooking skills, and ways to work physical activity into their daily lives. As our work in health equity expands, there are a lot of folks in rural communities that need programs like Target BP. There are a lot of clinics all across the country that don't have the resources to treat the patients that are walking in the door. I'm reminded of an interaction with our colleagues in Nashville where they walked into a community clinic and they only had one blood pressure device for their entire clinic. So patients that were coming in the door weren't even able to get that initial reading when they walked in. So there's a lot more we can do in terms of driving funding to support clinics. We have an Adopt a Clinic program now to make sure every clinic can deploy the best practices of Target BP.
145 over 92.
180 over 111.
I think about the real patients that we're featuring in our Blood Pressure Ad Council campaign. That campaign really seeks to tell the story of people with uncontrolled blood pressure and the physical impact of that uncontrolled blood pressure. So we're telling the stories of people that have the after effects of a stroke or perhaps have a scar because they had a heart attack and had to have a procedure. I worry that if we don't continue this work, we're going to have many more of those stories to tell, and that's really what we're fighting against.
I am always impressed with the vision and the impact that our local American Heart Association team brings to the Coastal Bend and the 9 counties they serve. Many of you might not know, but our market has recently converted into an active community impact market, which means that we now have more ability than ever to deploy the work of the American Heart Association into clinics, community programs, and organizations across the region. We want you to know our audience and even our panelists are the big picture on what's happening in the American Heart Association's role right here in the Coastal Bend. Now let's go ahead and move into the panel discussion portion of our conversation. Please remember to add any questions you have in the chat box below. We will have time at the end for a Q&A with our panelists. Dr. Alma McDaniel, good morning. Let us start with you. Can you explain hypertension? What is it?
So hypertension, also known as high blood pressure, is a measurement of the force of the blood as it flows through your blood vessels. So if that force is consistently high, then it's considered medically termed hypertension or high blood pressure. So you, in that video you just saw, as well as when you go to your doctor's office, you're given 2 numbers, something over something. So that top number in blood pressure is the pressure of the force in your blood vessels when your heart is beating, and that bottom number is that pressure when the heart is relaxed or not beating. So you're always given 2 numbers, and they both can determine whether you're having high blood pressure or not.
Thank you for that. Sometimes we always notice, right, our families will sometimes talk about that top number and they forget about the importance of that bottom number. And so we'll review that and review those numbers and what is healthy and what is not healthy, because those parameters have changed through the years. And some people have obviously not kept up with those changes. And so we want to make sure that as we're educating the public, we know what's considered normal, what's considered elevated, and what's considered an actual stage 1 and stage 2 hypertension. And so we'll visit that topic again during this conversation. Can you discuss some of the risk factors associated with hypertension?
Sure. So some of the risk factors, and we like to talk about what's called modifiable, or things that we can change, we ourselves, along with your provider who can help you with that. And then we call non-modifiable. So let's just talk about non-modifiables, things that you kind of can't really change. So some of the risk factors are increase in age. So as you get older, vessels get a little bit harder, and so blood pressure does go up in that case. Family history, if you have a family history of high blood pressure. So if your parents or your brothers and sisters or grandparents have had blood pressure issues, then you're at higher risk of having blood pressure issues yourself. Race is another factor. We know that African American people have a higher risk and even more severe high blood pressure, ethnicity, and gender as well. So in men under 64, they're more likely to have high blood pressure. But once we hit about 65, it switches. So women are more likely to have high blood pressure. If you have kidney disease or known to have chronic kidney disease, that can affect your blood pressure. So those are the things that you kind of can't change for yourself. But the things that you can change, obesity is a big one. So having a healthy lifestyle and diet, diabetes, controlling your blood sugars, high cholesterol and things like that. Obstructive sleep apnea. So if you've ever been told, or you might think that you have obstructive sleep apnea, that can definitely affect your blood pressure. And then again, lifestyle things like diet. So eating a high sodium diet or high processed food diet, cigarette smoking is a big factor, excessive alcohol intake, and also physical inactivity. So if you're not being physical every day, then that can also affect your blood pressure.
Thank you. And thank you for breaking it up into two categories. I think oftentimes patients and family members will sometimes focus on those risk factors that we can't do anything about. But I think it's so important to say there was a long list there of things you can change, things you can manage, and you don't have to follow in the footsteps of your family. A lot of us have family members that have had high blood pressure or even succumbed with diseases, as we shared our why, and have passed away young, and we don't have to continue that, what I always say, family tradition. And so by modifying those risk factors, we can change those that risk of ischemic heart disease and stroke and succumbing to that. So thank you so much for mentioning that. Can you talk a little bit about the importance of knowing your numbers? More and more we're hearing it's not enough to just go to the doctor every year and have your blood pressure check. I always like to ask my family, what were your numbers, and have them written down and have them understand what those numbers mean and how that can change over the years. I know you touched on that topic a little bit, but I know we're all probably not the best patients. And so sometimes we might have taken our blood pressure 5 years ago, and in our mind, we think we're fine because our blood pressure was fine, in 1982. And so it's real important to kind of continue that. Can you talk on that topic a little bit, Dr. McDaniel?
Sure. So the importance of knowing your numbers, knowing what your blood pressure is, like Dr. Garcia-Blow said, if your blood pressure was normal, a few years ago, even a year ago for that matter, it doesn't necessarily mean it's normal today. And like I said, as you age, you're more susceptible or at higher risk for getting high blood pressure. So you talked a little, Dr. Garcia-Blow talked a little bit about, the numbers and how they've changed over time. So when you're talking about the top number, the systolic blood pressure, anything less than 120 is considered normal. And at that point, you just want to continue with your lifestyle, right? Once you hit about 120 to 129, you're getting an elevated blood pressure. So that's when you want to pay more attention to, your healthy lifestyle choices, diet and exercise and things like that. Then when you're getting that top number up to 130 to 139, you're looking at stage 1 of hypertension. And so at that point, you're getting more at risk for cardiovascular events like Dr. Garcia-Blow was talking about, such as stroke or heart attack and those things like that. So not only at that point do you want to continue with your lifestyle changes, but also see a physician or a provider because you're needing to start medication at that time. And that's important to know that. And then if you're going even higher to the 140s or above in that top number, you're at even more increased risk of adverse events, right? So it's important to know those numbers. It's important to talk to a provider about those numbers. It's important to talk to your family about those numbers because, like we said, you have family history and you have other things that you can't change. So they need to be aware of the things that they need to be looking at as well.
Very much, Dr. McDaniel, for that. And, as we've mentioned earlier in the video, we share resources for heart disease and high blood pressure on www.heart.org, where high blood pressure can be found under the topics tab. We will share the link in the chat box. And this is such a useful website, and it has so much information. And one of my favorite charts that it has on there is exactly what Dr. McDaniel was focusing on the elevated and the different stages of high blood pressure. And one of the most important little details that I always mention to patients is that when you look at systolic blood pressure and you look at diastolic blood pressure, that lower number, you see that on that chart, it specifically says or, which means if your systolic blood pressure is 116, but your diastolic blood pressure is between 80 and 89, that is considered elevated. And so that's so important, that second number that nobody ever, at least in the past, we didn't mention it so much, and our family members always tell us that top number. And so it's so important, that diastolic blood pressure, and if that's between 80 and 89, so important to recognize that that puts you in a stage 1 category. And so if there's one thing that you take from today is go to www.heart.org and learn more, because sometimes it's not your own life. You may be here and are very much vested in your health, but you could save the health and the life of your family member, friend, neighbor, and that's what we're here for. So thank you so much, Dr. McDaniel, for all of that wonderful information. Dr. Thank you so much for joining us today and providing your perspective on high blood pressure in patients and across our community. As someone who sees those suffering with heart complications every single day, we would love to hear your thoughts on some of these issues. Can you speak to us a little bit about the complications of uncontrolled hypertension and what you see every day in your practice?
Sure. So the most important thing to know is if left untreated, it can put you at risk for potentially life-threatening complications. So, having uncontrolled hypertension or high blood pressure can affect all of the organs and all of the blood vessels to your body. So it increases the risk of hardening of the blood vessels and puts you at increased risk for atherosclerosis. And so even if you're feeling good, this damage is still happening. So that's why it is important to make sure that you're getting doctor's attention and treating your blood pressure, even if you're not feeling bad. And so this can increase your risk for heart attack, for stroke, increases your risk for heart failure. The high blood pressure can damage the blood vessels that go to your kidneys. And so it can also cause long-term kidney disease. It also affects the little blood vessels that goes to your eyes. And so patients can develop vision problems and sometimes completely lose their vision. And then also, it can cause some sexual dysfunction. So women can have low libido or erectile dysfunction in men. Also, having high blood pressure can decrease the blood flow to the heart muscle. And so a lot of times we do see people coming in with chest pain and in hypertensive crisis where the blood pressure is extremely high and they have to be hospitalized to treat the blood pressure and bring it back down with medications.
Yeah, it's so much that it can affect. And sometimes we only concentrate on some organs, and the truth is it can affect everything.
Yes.
What things we hear so much in general practice and maybe amongst our friends and neighbors are that the different medications can oftentimes make them feel more ill. Oftentimes we talk about high blood pressure being a silent killer. And so they actually feel fine when they're not taking anything, but they feel sick when they're taking their medication. What are some side effects that we can talk about and some advice that you offer to your patients as to how to make those side effects a little bit more palatable?
Sure, yes. So many medications have side effects, and of course, blood pressure medications are no exception. Generally, they're well tolerated. They can be some minor symptoms, a little bit of dizziness, some fatigue, but there are so many different medications that we use to treat high blood pressure, and each group of medications does have some specific side effects that come along with it. So a lot of times we'll use what we call diuretics or medications that can increase urination. These can also alter the electrolytes in your blood, and then also, increase your urination and increase dehydration. Those can also predispose you to some dizziness. There are medications called beta blockers that we use in specific situations as well. This can cause sometimes insomnia, sometimes fatigue. It does decrease your heart rate. And, ACE inhibitors are another medication group that we use that can sometimes produce side effects like dry cough. And so a lot of different medications have some specific side effects. There are more dangerous side effects that if you start experiencing any concerning symptoms or you just don't feel right, the most important thing is to talk to your doctor. Sometimes it can be easily fixed with just a dose adjustment or changing the medication. But the main thing is to know not to stop the medications, to call your doctor immediately so that we can address this and that we can treat it accordingly.
Thank you so much. That's such an important point to bring up. Can you talk a little bit about some of the common misconceptions that you see in your practice and some preventive measures that we can do every day in our lives?
Absolutely. So as you mentioned earlier, hypertension is a silent killer. So a misconception is, I feel good. Why do I need to have this treated? And like I said earlier, the fact that you still feel good is not a reason to not treat it. This is causing damage to every organ, every system in your body. And it is very important to treat it, even if you do feel well. And so that's the most important thing, is it is a silent killer, but there are things that we can do to, do this other than medications. People think, medications are the only way to treat high blood pressure, but also we can take on these risks and try to modify them. Like stated earlier, we can eat healthy, reduce your salt intake, reduce your alcohol, exercise, keep a healthy lifestyle, maintain a healthy weight, and try to modify what you can to reduce your risk of blood pressure, and then also use that in accordance with blood pressure medications.
Great. Thank you so much, Dr. Cuevas. We really appreciate all of that information. I'm going to switch over to Belinda Flores and get some perspective on health and nutrition. Belinda is a part of our Hypertension Collaborative and just such a great resource in the Coastal Bend. Belinda, can you talk a little bit about diet's effect on hypertension and what the best diet is for those with high blood pressure?
Thank you, Dr. Garcia-Blow. I appreciate the opportunity. One of the things that we can control, like Dr. McDaniel was saying, is our diet, what we intake. And so the best approach to diet will be lowering our salt intake. Many times we think it's the table salt, but we have to consider, yes, we should never keep a salt shaker on the table. It should never be added. We can think of other things that we can use to substitute, but thinking about things that also have salt, like ice cream. Many people don't think about ice cream being made with salt, things that are frozen, canned goods, things like that. So we want to limit the things that we eat that have higher content of salt. So we want to lower our salt content. The other thing is we really wanted the things that we eat, our diet, we want it to be in moderation. We want it to be a balanced diet with plenty of fruits and vegetables, including whole grains, these kinds of things. So really keeping an eye on the salt intake is our best thing we can do when we're trying to monitor our hypertension. Again, we think about bad food and good food. It's just food. It's in moderation. We don't want anybody to be like, well, I'm not going to do, I'm not going to eat this or not, because eventually we want to eat that, but let's eat a little bit of it. So monitoring our intake.
That's right. Thank you so much, Belinda, for mentioning that. I think sometimes we're so extreme, right? And we think we're going to cut everything off, but the truth is bad diets don't work. And it's the same principle all of the time. And so really being able to change some of those small changes so that they can be long-lasting changes, since we know this was a chronic disease that we'll manage for the rest of our lives. And so it's really important to be able to stick with it. Can you talk a little bit about social determinants of health? I know those of us in the medical field, we know the term social determinants, but can you describe it a little bit and how that affects high blood pressure?
Absolutely. I think social determinants of health really affect our communities, especially especially now with our economic instability. Many people have lost their jobs. They're having to go to our food banks, that kind of thing. So it really affects our health. The stressors part of our community, right, is that high stress. So monitoring our stress levels, there's many things now that you can use with your smartphone to lower your stress levels, making sure that you're seeing a provider, getting that annual exam every year. We have plenty of providers in town that if someone doesn't have insurance, they can go to our federally qualified health centers that we have in town. We have our Christi Spawn Clinic that's in town as well. So making sure that people are able to have access to care is very important. That is one of the biggest ones of the inability of not, or thinking that, well, I don't have insurance, what am I supposed to do? But really using the resources that are out there and always asking, right? When in doubt, just ask. You know, we all talk to our friends, our family, what should I do about this? But making sure that we do access those resources that are in our community, because those social determinants of health do affect our community. For our rural communities as well, being able, the transportation issue, we don't have transportation, but only here kind of in our area. So making sure that how can we work together, making our health a priority, because guess what? We find ways to get to the bingo, or we find ways to get to the mall or places we want to be, having our health making our health a priority, finding, you know what? I'm going to go for my checkup.
Thank you, Belle, for that. And thank you for mentioning a lot of the services that exist within our community. I think oftentimes people don't realize all of the different organizations that serve the community. So if you have insurance, if you don't have insurance, if you don't have a doctor, if perhaps you have insurance, but it doesn't cover a lot of the benefits, there's so many nutrition classes, there's so much opportunity to find a way to be able to get healthier and live a healthier life, even if the resources and the ability to be able to get to places may not be there. And so look in your community. I know through the Hypertension Collaborative, we're working on being able to really look at these food deserts where there's an inability to get healthier food in certain areas. We're also trying to put together a map that shows where you can find an office, where you can be seen, where you can find resources within your local neighborhoods that oftentimes people may not know about. So again, thank you so much, Belle, for all of that information. We know the American Heart Association as the heart organization. What we don't regularly think of is that the health equity and social determinants of health are at the forefront of what the American Heart Association is working to level in our communities. At the core of our work is the mission to live years longer and healthier lives.
We've come to realize at the American Heart Association that while it might be easy to think about the idea of reducing deaths from cardiovascular diseases and stroke and what you do in the clinical setting, and thinking about improving cardiovascular health, it is not as easy for each individual, for all Americans, if you will, to get to that place. And that social determinants of health, social factors, are the way we describe those non-clinical factors that have a huge effect on people's health. Zip code for many, many people may be more important right now than genetic code. And it's not unreasonable for us to ask ourselves why, and is that okay? And we came to realize we cannot get to better cardiovascular health until and unless we think about care, and we think about behavior, and we think about social factors. If each of the influencers takes on a piece of this, we might be able to comprehensively and methodically move the needle in a positive direction, understanding that good doctors and great hospitals is absolutely necessary, but not sufficient. as an organization to engage in that really more complicated place of figuring out what things we need to be all involved in to improve the heart health of all Americans on the path to achieving optimal health for all.
Wow, in that video was Dr. Eduardo Sanchez, Deputy Chief Medical Officer for the American Heart Association, AHA. He brings an interest and expertise in prevention and population health. Dr. Mohammed Emran, thank you so much for being here with us. You're extremely busy and we really appreciate your time. As a pediatric surgeon, you bring a completely different lens to our conversation today. Can you talk a little bit about pediatric hypertension and obesity, some of the risk factors associated with the pediatric population?
Yeah, thank you very much, Dr. Garcia-Blow. Obesity is really, it's been obviously the first pandemic that we've been dealing with in the beginning of this century, and it's kind of fallen by the wayside because of COVID. But it's no less a problem now. And in fact, we're seeing the complications of the COVID pandemic impacting that as well. Here in Texas, we have a large portion of our pediatric population have obesity or are overweight. And one of the biggest problems we've run into is how these things are measured. Because if you look at the official Texas statistics by the Texas government, they tell you that only 17% of the pediatric population between 10 and 17 years of age is obese. Now, clearly that's not, we didn't suddenly fix the 40% that was being reported 2 or 3 years ago. It's just how are they measuring the problem? So really, statistically speaking, 40%, 30 to 40% of Latino children, 30 to 40% of African American children, and probably around 30 to 35% of white children here in Texas are obese or overweight. Which means at least a third of our children, if not more. The problem, again, with that is how do we measure this? We're measuring based on two things, their height and their weight. And so we're using their weight and their BMI. But when you actually measure body fat percentage, you find out that the proportion is much, much higher. Similarly to adults, when we measure, we find out that the proportion of obesity is much, much higher when we measure body fat percentage instead of just height and weight and BMI. And this is one of the explanations why there are people who are overweight who get heart disease and diabetes, and there are people who look like they're thin who get who get diabetes and heart disease as well. It's more about the composition of their body rather than this. And of those kids, probably around 2 to 4% of the population have hypertension. And we know that kids who are overweight and hypertensive are going to become more likely than not adults who are overweight and hypertensive. So it's really important to begin to address this issue now, because not only does it have a huge impact on the health of the patient, but obviously the family goes along with them. And the cost for taking care of these kids is almost $12,000 to $13,000 more per year for each one of these kids. And if a third of our kids are overweight, that means that we're spending tremendous amount of money on things that are completely preventable. If we were just to put that money towards better nutrition and exercise funded by the state, then we wouldn't be state funding the healthcare for that problem as well.
Wow, those numbers are just staggering. And I think sometimes it's missed. And like you said, if the treatment can go into the prevention instead of treating a chronic disease that we know they're going to deal with, that would be probably a much better way to handle this. Can you talk a little bit about the advice that you give to families? We oftentimes talk about the choices they're making as far as food and sugary drinks, including juice, and maybe some misconceptions that people believe that they're making healthy choices for their kids, but perhaps they're not, or they could be making healthier choices.
Right. I think you got both you and Ms. Flores have mentioned some really important things, and I think it's not an all or none phenomenon when it comes to being healthy. I think, people sometimes think that, and they think, well, oh, I can't eat healthy, so I'm not going to do anything. I'm not going to worry about it. Oh, I can't be an athlete, so I'm not going to do any exercise. And I think that barrier needs to be broken down, that every little bit makes a difference. And so one of the things that I lead the families through is making small changes, and I have them identify the things that they think that they're not doing well, or they think they can make an improvement in, and then we make one small change. So for instance, they'll say, we don't eat enough vegetables. Great. What vegetable are you willing to eat? Okay, and what day are you willing to eat that? And then they say, well, carrots, and they say Monday, and I say, okay, great. So every Monday for the next month, you're gonna have carrots with dinner. And they do that, and they come back, great, we got to win, okay? And then we start seeing these little changes, this just little bit of awareness, this tiny little thing suddenly start having an impact. And they're like, wait, we lost 2 pounds just doing that. And you're like, well, yeah, imagine what would happen if we make the next step, right? And so then we do the next little thing, another vegetable, another day, another vegetable, another day. And then eventually we get up to the 3 vegetables, and it's taken a while, but all this time we're making slow progress. So that's kind of the basic guideline that I give them, is make small changes that you and everybody else in the family agrees to, and that you can easily measure. When it comes to things like juices and sugary drinks, I try to get them all to set a treat day where they can have whatever they want. That's the day they celebrate the birthdays. That's the day they go out to eat. That's the day that they're going to order in pizza. So that there's never this feeling of, I never get to have, oh, we never get to have these things. No, we're going to plan it out. We're going to have a lot of fun. And then it becomes a family experience where they're planning out their treat day. So, oh yeah, I want to have ice cream. Oh, I want to have this. I want to have that. Okay, great. We put it all on the treat day. And then that way the rest of the week is healthy. And then when it comes to things like juices, I tell them, if you really want a juice, it's better to juice it yourself, make it yourself at home, because the fresh juice is much better, has a lot more nutrition. But ultimately, we're not juice drinking animals, all right? We don't run around the forest sucking the juice out of fruits off the trees. We eat the fruits and vegetables, and there's a reason why we do that. It's because that's the way we digest it, and that's the way that it manages how we absorb the sugars and so forth from it. So when it comes to that, I recommend not doing it on a frequent basis, but I know even my kids are always asking for juice. So we, once a week, it's not a big deal. And every once in a while, in the context of doing other healthy things, it's not that big a deal.
Thank you. That's all such wonderful information. And I think one of the focuses that you're mentioning is how to do this as a family, and how, it's really important to be able to have everyone doing the same thing. I think oftentimes we have patients that feel isolated, whether it's the children or the adults in the family, that only one person can eat, has to eat really healthy, and how that's very difficult. And it really has to be a family approach to get the family healthier. And so it's that way with exercise as well. Can you talk a little bit about that, about the importance of doing it as a family, how it improves stress levels and helps that bond, both with all-inclusive lifestyle changes, diet, and exercise?
Absolutely. And that's one of the main reasons why we've actually abandoned doing bariatric or weight loss surgery on kids, because what we were finding was that when you said the child had a surgical problem and we did surgery for it, everybody treated it like appendicitis. Oh, you have a disease, you did the surgery, it's over, we're done. And nothing changed in the whole family. So the family would just kind of, point to the kid and say, well, the kid had the problem, and nothing changed around the household. So we completely abandoned the idea of doing surgery, at least at Driscoll. And now we're doing a lot more family counseling, where we try to get them to make these small changes and do it together as a family. And what we found is, instead of getting 60 pounds of weight loss in one person for a short period of time with a surgery, now we're getting 60 pounds of weight loss in the entire family over a gradual period of time, but it's much, much more durable, and they're less likely to regain that weight. So some of the things that we tell them to do, number one, getting outside on a regular basis. And that can start being, 5 minutes, just walk around the house outside a couple times a day, or just get outside in the sun. And people really underestimate the value of it. We're talking about hypertension, and one of the main things that drives hypertension is lack of nitric oxide in the blood, which helps relax the blood vessels. One of the problems is that nitric oxide conversion happens in the skin with sun exposure. So all of us sitting inside more of our day, we get less nitric oxide, and so it becomes a losing battle all the time. Not to mention vitamin D levels and all these other things that contribute to obesity and long-term worsen the problem of hypertension. So getting outside, getting in the sun, making those small changes to eat healthier, getting regular exercise, and we try to do it, encourage them to do all those things as a family together.
Thank you. Thank you for all of that wonderful information, Dr. Amran. You'll see on the chat that we've shared some links to simple cooking for kids and some physical activity. One of the great programs that the American Heart Association has brought to the Coastal Bend is Kids Heart Challenge. Having children myself, I learn all about healthy habits thanks to our daughter bringing that home to us. So please look at those links and get more information. Christina Perry, thank you so much for joining us. One of the biggest things that we're seeing today are the challenges that COVID has brought to our community, and also, and more specifically to our population with high blood pressure. Can you talk about these challenges and what you're seeing?
Sure, thank you so much, Dr. Garcia-Blow. So COVID is kind of having multi-effects with high blood pressure patients. The American Heart Association researchers have linked the disease caused by coronavirus directly to multiple heart-related issues. And it's also contributed indirectly to deaths among people who had cardiac problems but maybe delayed getting treatment from fear of going to the hospitals. The main concern for patients with underlying heart conditions is that COVID-19 causes respiratory stress on the system, and that worsens these conditions. It can worsen the COPD, the congestive heart failure, the hypertension. So, and even the lung infection itself can cause heart failure. So people with underlying conditions such as hypertension really need to be extra careful in maintaining their medications, controlling their symptoms of their chronic diseases to help mitigate the risk of the acute disease process like a COVID-19.
Thank you so much for that. And one of the big questions that we see is it safe to go to the hospital?
Yes, we get that a lot lately, and we have for the past year. It is safe to go to the hospital. There are screening processes in place for all patients, visitors, clinicians. There are separate care locations for COVID patients versus non-COVID patients in the facility themselves. There's masking throughout the facility. That's not going to change anytime soon. Those patients that need outpatient procedures get tested prior to coming in for the procedure to make sure that we're not introducing COVID-19 into the facility. And then just a heightened infection prevention, making sure that hand washing is being done. There are sanitation and sanitizer dispensers throughout the entire facilities. They're pretty much everywhere. Food and drinks are now prohibited in all clinical areas, just to help, again, prevent the spread of any kind of airborne diseases. And most facilities have updated visitor policies, whether that's limiting the visitors to a certain number or to certain hours of the day, but just to truly control the environment and to make sure that it's a safe environment for patients, visitors, and staff.
That's right. And thank you for giving us all of that information. And I think more importantly, it's the emphasis that we know it's not safe to delay care. We know that the risks that come with the diseases and not seeking care when you need it is going to be much more detrimental. And so thank you for all of that information. One of the issues that we know everyone is dealing with, and especially our patients with high blood pressure, is stress. Stress related to the pandemic, stress related to the economics of it. And of course, we even had an Arctic freeze in South Texas. And so there's so much going on. So what are some of the things that you recommend to decrease stress in the face of the year that we faced?
Yeah, it's been a pretty hard road to hoe for a little while. And you're right, between COVID and the pandemic and the economic factors, it has been stressful. Belinda mentioned earlier, there are several apps that you can get on your phone that can help you relax a little bit, take you to your peaceful place, take 10 deep breaths, you know, just kind of focus on yourself for that moment, let go of your external stressors. But one of the main things with our patients is, one of the things that we did notice is hypertensive patients weren't necessarily coming in to see their physicians on the regular basis because they were afraid to come in. And so they had the added stress now of, I need my medications, I might need to have an adjustment, but is it safe to go in? And so one of the main things to remember is that our patients need to stay on their medications. They need to see their physicians regularly, know your numbers. And sometimes just knowing that you're doing the right thing for yourself and for your disease process can help lower that stress. So it's a twofold. You take care of yourself physically, and that's also going to help your mental stress level. But if you need to, you know, unwind a little bit, read a book, find some quiet space. As Dr. Emron mentioned, find a quiet place out in the sun, get some sunlight while you're doing it. But possibly get the vaccine if it's a good fit for you. Talk to your physician about getting the COVID vaccine. Getting that stress removed of, am I going to get it, can help your mental state as well. But as you mentioned earlier too, Dr. Garcia-Blow, if you feel that you're having any symptoms of heart disease, whether it's numbness, chest pain, anything that's going wrong with your system, and patients know their bodies better than anyone, listen to your body, go to the ER, call your physician. Don't let that added stress of, am I dealing with something? Am I not dealing with something? The unknown is always the biggest stressor in the world. Remove that unknown. Know what you're dealing with, know your numbers, and that should help greatly.
Great, thank you so much for that information. We did have one question come through, Dr. Cuevas. I'm going to call on you for, does my resting heart rate have anything to do with my blood pressure?
And so the resting heart rate depends on a multitude of factors. And so are you on medications that is controlling your blood pressure and reducing your heart rate? People who are very physically fit, you know, you think of these athlete level people, they're going to have a lower resting heart rate, and that's not anything that we get concerned about. But also people who are on the flip side of that coin, inactive, you know, their heart rate will speed up with very little activity. And so the heart rate in of itself is not going to predict your blood pressure. They can be correlated in some ways, but there are multiple things that do influence the heart rate. When we get concerned about the heart rate, if it's below 40, or, you know, if it's going super fast and you're feeling bad from having an abnormally elevated heart rate. So if you have any concerns, you know, first we would evaluate and take your blood pressure, take your heart rate, and then likely do an EKG to make sure there's no abnormal heart rhythms. And then, you know, find out what we need to do to treat it.
Great, thank you so much for that wonderful information. Belinda, a question did come up about the resources in the community. Can you elaborate a little bit on that topic?
Sure, thank you so much, Dr. Blow. Some of the resources, for example, we've been trying right now, especially because of COVID, we've been trying to use 211 as a big resource here in our area to call 211, and they are very knowledgeable of different resources, whether it's where to see a doctor, you know, where to go for COVID testing, you know, different things. So I think that's very important. Also, I think knowing that we have those clinics, like I mentioned, our federally qualified health centers, our Hector P. Garcia Clinic, Mission of Mercy, the Gabbard Health Room. So there's resources available in our community, and we need to make sure that our community is aware of them. Our food bank knows about different classes if you need classes of how to lower your blood pressure, things like that. So when in doubt, just always ask.
Thank you so much. And wow, what a wonderful panel and wonderful information. I am inspired. I am ready to go out and exercise and have a healthier lifestyle that I know I have. It looks like we're coming to a close. Just cannot thank all of you enough who are incredibly busy, and we appreciate your time and your willingness and your focus on educating our community, which we know will make the big impact, is having this time, having this education, and maybe saying it in a different way. So thank you so much for being here. We so appreciate you taking the time to spend with us this morning. During this time of social distancing and many people working from home, the AHA would like to ensure we're providing value to our community in many ways. We hope you have enjoyed today's community conversation on high blood pressure. I know I have. We hope that you will register for our next community conversation, which is coming up in May. As we focus on this pandemic and everything else we've dealt with, this community conversation in May will focus on mental health. It'll be brought to us by Oceans Healthcare. Also, check your email. We will be sending you information following this program on 3 key themes: mental health and stress, physical activity at home, eating healthy, and all the factors that lead to high blood pressure. Please share that information with staff, coworkers, family, friends, neighbors. Additionally, you'll find more resources at heart.org.
I'd also like to thank all of our panelists and our guests, and of course, our moderator, Dr. Nellie Garcia-Blow. The #1 way to defeat the silent killer is talking about it. It means the world to us that you have taken time to join us today to discuss hypertension and its impact to heart disease and stroke, to learn about social determinants of health and the impact of obesity in pediatric patients. We hope this discussion has empowered you to know your numbers, and if you have hypertension, meet with your doctor and work out a plan that works for you to get it under control. We invite you to visit heart.org for more tips and tricks for controlling your heart health. Thanks again for joining us, and have a wonderful day.